Hello, everyone. My name is Mustafa Zahid, and my paper title is The Impact of Cleft Lip and Palate and Cleft Lip and Palate Surgery on the Social Integration of Adolescents in India. This paper first came to life as my master's thesis, and it originated in a project I managed for a couple of years. And so I want to recognize the collaborators in that project at the University of San Francisco. I also want to thank the research and color team and Professor Tabnit Suri for providing me the opportunity to learn and grow over the past couple of months, as well as strengthen this paper, which is close and dear to my heart. So without further ado, let's get into it. Cleft lip and palate is a congenital orofacial anomaly. The main causes of the condition is genetic, but also partly environmental. In the developed world, cleft lip and palate is usually treated in the first couple of months of the infant's life. However, in the developing countries, and especially in rural areas, cleft and palate patients can go all their lives untreated, and that can lead to adverse impacts, both physically and socially. From the field of development economics, we know that there are both internal and external constraints on development. Cleft lip and palate is, in a sense, an external constraint on development that exacerbates an internal constraint in development. In this case, for example, it could be perceived self-efficacy, and that exacerbation can be mediated through the social exclusion that is resulted from cleft lip and palate. And so in this study, we investigate that. The prevalence rate of cleft lip and palate varies across the regions of the world. However, globally, it's around 1 in 1,000 births. The limited availability of surgical care and scarcity of skilled surgeons in the developing countries can lead to huge backlogs. For example, in India, the estimated backlog of untreated conditions varies from 250,000 to 1 million of untreated patients. To causally estimate the impact of cleft lip and palate, we utilize a cross-sectional difference in differences with fixed effects. So we take the difference in outcomes between the treated patient and their closest age sibling and the untreated patient and their closest age sibling, and then we take the difference in differences. In the model specification over here, we utilize fixed effects, household fixed effects, so we are looking at variation within the household. We also cluster our standard errors at the household level. The identifying variation in this case is that the presence of cleft and palate and the treatment. The identification assumption here is that the absence of cleft and palate, the difference between siblings is constant. So the main outcomes that we look at is the social integration index, which is composed of two main indices: social inclusion, how the patient is treated in society, and prosocial behavior, how the patient behaves in society. And as you can see on the bottom right corner graph, cleft lip and palate is not a binary condition. There are varying levels of severity, and depending on the level of severity, the number of required surgeries varies. And as you can see, the majority of patients in our sample do not receive the full amount of surgeries that they require. The location of the study took place in West Bengal mainly, but also other states in India. So let's jump into the main results. We can see that there is a statistically significant negative impact of cleft lip and palate on social integration, mainly led by the negative impact on social inclusion. And specifically, if we focus on the bullying frequency variable in the bottom left graph, we can see that the distribution of the outcome for cleft lip and palate patients gets closer to the distribution of non-cleft lip and palate adolescents as they get more treated. So potentially alluding to the positive impact of cleft lip and palate surgeries. Here's the point estimates of our model. We also look at heterogeneous impacts, and we look at interaction of gender and birth order. And we can see that birth order does have an effect on the impact of cleft severity and cleft surgery. We also see that our point estimates are robust when we use regular OLS without fixed effects and include a wealth index at the household level. And we can see our point estimates don't change that much. And there's a positive relationship between wealth and the outcomes that we observe. Finally, we want to see what drives the impact of cleft severity on social inclusion. And there are two main mediators that we focus on in the paper: the speech quality, which is assessed by a speech therapist of recordings that we took of patients in the field, as well as the physical implications of cleft and palate. So this could be indentation on the lip from the cleft lip, or a scar from the surgery. And what we see is that speech quality potentially mediates the impact of cleft severity on social inclusion, as we see here in this table. However, we cannot rule out other potential mediators of the impact of cleft severity on social inclusion. Finally, the contributions of this study, first to the literature identifying causal impact of cleft lip and palate and the surgeries on social migration, also demonstrating the potential alleviation of internal constraints in development through surgical intervention. In terms of contribution to policy, we demonstrate potential impact of investing in speech therapy for treating cleft and palate patients in the developing world. Usually, treatment protocol is only constrained to the treatment of the surgery itself. And so investing in speech therapy can potentially lead to positive impacts on the patient's outcomes. Thank you.